one big thing about targeted therapies as a whole is program cell death. Program cell death for that anti-cancer drug, or chemo, I should say, for the cancer itself. The limitations that are associated with these targeted cells is the cost. They're highly expensive, and some insurance companies will not allow patients, or won't cover the cost of these targeted therapies. So that's a limitation. So it definitely has to be checked with, and the physician has to write strong reasons why they would want to use targeted therapies compared to anything else. So it has to be a strong argument in order for these insurance companies to cover it. So different, the reason why is it's expensive is because it does these 5 things when it comes to targeted therapy and that programmed cell death. There's many different types that fall under, or subclasses that fall under the big class. We're going to hit on a few minimal, because again, we could be here for hours. Small molecule compounds. Small molecule compounds, just enough for internal cell structure. So it interferes with the internal cell structure. It classified according to these actions. The reason why they like these small molecule components or compounds is to inhibit enzymes to induce apoptosis, which is synthesis into that fragmentation, and then to inhibit the formation of new vasculature. Cancer needs a blood source to grow. So by using this particular drug, it inhibits that growth so that it can't grow and then it dies. That's how they can prevent that cancer from growing or happening as a whole. The angiogenesis inhibitors, this inhibits the blood cell formation, is how that breaks down into the words itself. Side effects, we already know. Molecule compounds, if you look at this generic, it ends in nib, NIB. That's how you know it's a small molecule compound, NIB. NIB. So, monitor CBCs, lab values, big deal when it comes to this particular. When you're talking about these 2 classes, the triazine kinase and the multi-kinase inhibitors, one thing I want to point out with them is they also end in NIB. So far, targeted therapies have ended in NIB as a suffix. So that's how you identify them. And they have those 5 actions as a whole that we talked about. Clone, keep that in mind, antibodies. Clone, it is actually made in a lab. In a lab. If you think of clones, like that sheep they cloned and was made in a lab, that's how you're going to remember that. And the reason they like it is it inactivates and destroys the cancer cells. That is why they like these monoclonal antibodies. They end in MAB, so the sheep's name is MAB, M-A-B. Shantira, you're shaking your head at me. I think it's an easy way to remember it. We got to name things, right? That's how you remember. Make it personable. Hello, sheep, MAB. M-A-B. And that could stand for whatever you want it to. Okay? That's how you're going to remember. And that's what I want to mention about that. Questions about